Good afternoon, everybody. Hello and welcome to East Berkshire CCG Annual General Meeting. Thank you for joining us today. My name's Andy Brooks. I'm a GP and I'm the Clinical Chief Officer for the Frimley Collaborative Commissioning Groups, of which East Berkshire CCG is a member. We've got several things coming up for you in the next little while. I'm going to share with you a short introduction. We're then going to have a look back at the annual reports and accounts, which involves a few things, a looking back of the things that happened in the year which this AGM is about, which is 2019 and 20. A particular highlight about young health champions. It's also really important that the NHS, we share with you where the money was spent, and we're going to be doing that a bit later. Also thinking about the COVID-19 pandemic, then thinking about what's coming ahead, and also a time for some questions. So a few introductory remarks from myself. As you know, there have been some changes to the way we work in partnership. I mentioned at the beginning that East Berkshire CCG is one CCG, is a partnership of 3 CCGs, including North East Hampshire and Farnham and Surrey Heath. We've made sure that whilst we've built those connections, we've kept our really strong local connections within East Berkshire. You'll be hearing a bit more about that later. At the top of our screen, you'll see our little sort of jigsaw circle logo. That's been really important to us over the last couple of years that we've developed. So thinking about people is really important. Thinking about our places, and you'll hear more about our places in East Berkshire. Thinking about how we engage with communities and people like yourselves, but also how we're integrating services. And you'll see a flavour of that as we go through today. Person, place, engage and integrate. As you know, this has been one of the most challenging years in NHS history for everyone in our community, and whether that's here in Slough, Bracknell Forest or the Royal Borough, as well as nationally. We've responded to one of the biggest issues that health and care organisations have faced in a generation. We've had to rise to the challenges presented by coronavirus or COVID-19, and that's changed the way over the last few months we've been able to offer services, but we've been really passionate about trying to keep those high quality and safe services for our local communities. An example, I guess, of how that's changed is a meeting like this. Normally, we'd be meeting somewhere physically. I'd really enjoy going around, talking to people individually, looking at stands, listening to people sharing stories. That's all changed. And instead we're sat here in front of our screens, but it's still really important that we talk to you and share with you and listen to your feedback. I'd also like to take this opportunity to thank you and your family and your neighbours who at the start of the pandemic took time each Thursday evening to go out into the street and clap. I can't tell you how much that was appreciated by frontline staff and key workers during what was a very difficult time. For me personally, I went out onto my street and took part in that, and it was really fantastic, so thank you. I'd also like to thank you, as well as members of the public, how you've had to get used to different ways of engaging with health and care services, so whether that's consultations over the phone, video calls, or services such as e-consult. Your willingness to adapt to that has been really important and has enabled the local services to continue to function and to deliver services and to prioritise those where we've needed, and also to enable face-to-face appointments where we know that those are needed. So the purpose of this meeting is, yes, to look back. Even during the peak of COVID-19, we did not stop delivering services. We know that this year has been and continues to be a really tough time for everybody in the community, and thank you for your support of the NHS in these unprecedented times. As I said at the beginning, there will be time for questions, and we will answer as many of those questions as possible towards the end. So please, if you could put those in the chat box, that would be really helpful. In case we run out of time, Don't worry, we will still answer those questions. We'll take those away and we'll publish the answers to those questions on our website, as if you ask us questions that we can't answer here and now. But our commitment to you is to do that. It's really important for me that we listen to what you have to say. Your views do shape the services. I'm very fond of a phrase of "you said, we did." Hopefully you'll see some evidence of that in the thing that we present today, but your comments today, we will take those back and we will use those to help shape services for the future. So again, thank you very much for attending. I hope you'll find this session enjoyable and enlightening. I'd like to now hand over to my colleague, Dr. Lalitha Iyer, who is the Medical Director for the Collaborative. Thank you, Lalitha.
Thank you, Andy. It's my privilege to take you through some of the highlights of last year. Next slide, please. So I'm extremely proud to share that once again, we've been awarded an outstanding rating by NHS England. And this is a testament of our commitment to our patients and the way we work with our partners to look not only at health services, but also the health and well-being of our local population groups. As Andy mentioned, we are now working more closely with our neighbouring CCGs of Surrey Heath and North East Hampshire and Farnham, and have a joint exec that works across the 3 CCGs. Next slide, please. So following the pilot schemes last year, the CCG has continued to develop its outreach services for the homeless in our population. The CCG completed a deep dive impact assessment across all extended hours services in primary care to identify sectors of the patient population in East Berkshire which would benefit from improved access to primary care services. The outcome of this exercise identified that homeless and other vulnerable groups required improved access. So we worked in partnership with local authorities, charities, and local associations, and this has led to the delivery of new enhanced services in Maidenhead, Slough, and Bracknell. The service provides a dedicated GP and nursing support for this vulnerable group within each of our 3 places. If homeless people feel better and are accessing treatment for their physical and mental health issues, then their self-esteem and well-being improves. They are then more likely to positively engage with other services that are available to resolve their homeless status and follow a sustained pathway to improve their lives. Next slide, please. So this is yet another example of how invested we are as a CCG in looking after our vulnerable people and addressing health inequalities in the population. When COVID hit us early this year, we noted that there were vulnerable communities who were impacted by COVID. Some communities, like the members from Black, Asian, and minority ethnic communities, were impacted disproportionately. So rather than just an NHS response to this crisis, we collaborated with our key partners, as you see on this slide. We wanted to focus on vulnerable groups and ensure that the health of the population was being looked after in a holistic way. This slide just shows you the key partners that were involved and how the ICS is invested in dealing with health inequalities. This project in Slough started as a regional pilot, and we are now contributing to clinical data at a national level. Having led the way, we are now in the process of sharing the learning and implementing the work across the entire ICS. Next slide, please. For us as a CCG, it's always been about making sure that the services that we commission meet the clinical need and are delivered in a way that best supports our residents and patients. This slide shows you 2 examples of how we're implementing new ways of working and utilizing wider clinical skills to free up specialist time and thus reduce pressure on outpatient clinics. Ophthalmology services were reconfigured to provide patients with eye checks closer to home when they were on medications, and an example is chloroquine, which is given for certain medical conditions. We have also commissioned a novel service to make access for patients more easy by co-locating some of our community services at the King Edward Eye Clinic. This has been commended as a great model by our consultants who work at these services. The other service you'll see alluded to on this slide is the bid for diabetes. We were in fact one of 7 national winners for the bid for a low-calorie dietetic approach for diabetes. Low-calorie food packs are provided, but there's also support in a motivational way so that our patients can achieve the diabetic control that they need to optimize their health. Taking patients' needs in everything we do and hearing the clinical voice has always been paramount for us as a CCG. Next slide, please. Please accept my apologies for this overcrowded slide. This just portrays the various strands of our joint work with our partners. It shows you how, as GPs, we identify patients with complexities, how they are then referred to integrated teams, and there are frailty services in the community which help look after patients within their own homes. Having a more seamless patient journey is something that we have received a lot of positive feedback in the past, and therefore in partnership with our 3 local authorities and community services, it is something that we have focused on to make sure we're getting it right for the residents of East Berkshire. The discharge to assess framework is now mandated across the country following the initial COVID response. And Berkshire East, in fact, had already put this in place before the COVID response and has maintained this as business as usual. What it means is that it has demonstrated success in reducing delays in transferring care while improving longer-term outcomes for our residents through a person-centered multi-organizational working, enabled that more people are able to be discharged home, but with appropriate support. We've also provided enhanced support to care homes through the care homes quality team, which includes working closely with our social care partners to support our care providers and access to interim support and community beds. So if a patient's condition worsens slightly, then they are able to step up into community beds and step down, and we are enabling them to stay outside hospital, but in a safe manner. Next slide, please. Looking after our population and ensuring residents have access to information and support they need to take care of themselves and those around them is a priority for us. In terms of self-care, last year we focused on the top 5 illnesses or concerns as highlighted by our clinicians: hydration, blood pressure, UTI, mental health, flu, and some self-management courses as well. We wanted to provide condition-specific hints and tips for people who may really need them. Sometimes we know what we need to do, but it's just simple reminders that we all need in our busy life. An example of the work with hydration is attached here, and essentially it may be too small for you to read, but it talks about what dehydration is like and how important hydration is. So we shared this message with the public and also with our care homes where the elderly need to be hydrated well. Promoting wellness rather than just treating illness was the focus of our work. Next slide, please. As part of this work across primary care, our GP said that they wanted to do more. They wanted to work within the community, promoting messages of self-care. So we worked with our public health colleagues and local schools to develop a plan for 8 to 9-year-olds with key messages around hand hygiene and how to access NHS services. So from November 2019 to February this year, our local GPs visited schools across East Berkshire and spoke to over 500 children in their classrooms. The idea was that we would encourage children to go home, pass these messages on to their parents and carers to enable them to know where to go when they're feeling unwell. To support this, we gave school children bookmarks, flyers, stickers, and of course, the message on hand washing in hindsight was very good timing because this just happened before COVID. Now, if the technology works for us, we'd like to share a video about Young Health Champions. This was a project implemented across East Berkshire, focusing on young people's mental health. And after the video, I would like to hand over to my colleague, Deputy Director of Finance, Debbie Fraser.
How well we're doing this project is to recruit, train, lots of points as part of
the volume on the video seems low at my end, and if you're all experiencing the same problem, we could share the video on the CCG website. Thank you. Debbie, would you like to go ahead.
Yep. Okay. Hi, hopefully you can see me. Hi, good afternoon. I'm Debbie Fraser, Deputy Director of Finance of the CCG. I've got a couple of slides here to take you through the finances for 1920. The first slide, if we can move to this next slide. Thank you. Okay, so we've got our annual report and accounts. These are all available on the CCG's website, along with a summary version of the annual report as well. So this slide just takes you through the 3 sections that is within that annual report. The first is the performance report. So that report just gives us information about the CCG, its performance, both the successes, but also its successes against, or its achievements against the national targets, which will include 18-week referral to treatment and ambulance response times as examples. And also in here, we've got strategic priorities and the principal risks that it faces, the CCG faces. The second report within that annual report is the accountability report. That has members report within there, has a statement from our accountable officer, Andy, about discharging the CCG's statutory duties. It covers the annual governance statement and has a staff report. And the third section is the financial statements, which we're subject to an annual audit, and the audit report was in there as well. So you'll locate those there as well. Okay, if we can move to the next slide. So the next slide is a pie chart which displays the expenditure for 1920. The total expenditure is 632 million, and based on a population of 472,000, it works out roughly per person per year of 1,338, and per day £3.66, which is, I think you'd understand, is not a huge amount for each person. So it's really important that we keep our population healthy, to allow that 632 to be able to be used for those that need that those services. So the key area in here is the acute services. We spend 328 million on acute services. In terms of that, the main provider is Frimley Health, which East Berkshire spend 239 million per annum. The next largest acute provider is Royal Berkshire, which is 28 million, and Ashford and St Peters is about 7.6 million. The next highest area of spend you'll see there is our mental health and learning disability, which is about 61.6 million for last year. Our key mental health NHS providers there are Berkshire Healthcare and Surrey and Borders Foundation Trust. And included in this area as well is our ambulance and urgent care services. The remainder you'll see is spent on the key areas of GP services, community services, prescribing and continuing healthcare. And as a CCG, we're given about 9.5 million for our running costs. Principally that covers staff, but other areas as well. And last year we spent about 9.1 million. So the underspend there would have been used for healthcare services. If we can move to the next slide. Thank you. So this slide just summarises the CCG's financial duties to show that within our revenue resource limit, we can't overspend our revenue resource limit. So we stayed within that. We stayed within our running cost allowance and achieved our our target for the cash in bank at the end of the year. And in terms of our audit, we had an unqualified audit report, regularity opinion, and value for money opinion. So we achieved all of our financial duties for 1920. Okay, and I believe I'm handing over to Sarah Bellas, Director of Quality and Nursing.
Thank you, Debbie. Yes, you are. So thank you all, and let me start. So I've got a few slides for you to talk about the last few months and how we responded to COVID. The last few months have been difficult for all of us and all of our local communities. During this time, our focus has been and continues to be on keeping patients, families, carers and staff safe and supportive. The change for all of us has been really dramatic, and organisations had to respond at speed. I've been a nurse for 30 years and I don't remember change at this rate that we've seen this year. Across East Berkshire, health and care services have made remarkable progress to respond to the COVID-19 pandemic. And that change that we did meant that we saw things that we'd never seen before. We wanted to maintain the safety of patients and staff as we managed the COVID pandemic and ensure everyone needed the treatment for the virus and got the care that they needed in the best and safest possible way. Since March, all of our health and care systems, all of our services across the system have adapted the ways they work in order to continue to support people. And as you can see, we did things like faster decision making, we changed the national policy and guidance, and we changed the way we structured our organisations to respond. Even when we were in full national lockdown, our GP services never closed and we never stopped seeing our patients. As you can see, we've got a lovely picture of Dr. Malik doing video conferencing for you, and many patients will have experienced this kind of way of communicating. The way you made your appointment was probably different as well. You couldn't walk into your practice anymore and you're still being requested to contact by phone or e-consult. But if there is a clinical need for a face-to-face appointment, we will give you one, and we are giving people them. And we've put procedures in place to make sure that you are safe throughout the whole of it. We move to the next slide, and we've got a picture of Dr. Sachdev. So we've done a number of case studies and we've been sharing through our websites and social media, but in the local authority print and publications. And as we acknowledge that not everyone is online, we want to help residents to understand the range of ways to get in touch with their local GP surgery, because it's really important to us that these changes have been very difficult, and we want to make sure that everyone can utilise our services even though they've changed. And I think if you are somebody that hasn't needed to go to the doctor during this time, you may not know how it's changed. So we're trying to get those messages out for people to make sure that they know how to use our services. So what's next? So we've transformed how we work, and we're demonstrating rapid learning and effective working with our COVID-19 response. Some of these changes we hope to continue because they've been amazing and excellent and helped things, and some of them we're going to need to re-look at. But I think it's been amazing how we've been able to institute e-consult for GP practices, as well as all our new emergency care for those with mental health issues. As you can see from the slides, we've totally transformed the way we're working, and we did it really, really quickly. Thank you. I think it's Dr. Kittle next.
Here we go. Can you hear me?
Yes, Martin.
Okay, lovely. Sorry, I've got 3 minutes and I've got to keep to time, so tell me when I'm late. Yeah, Bracknell Forest, exciting place during COVID. Difficult sometimes, but very, we've certainly had a very good working together, and we never stopped from day one. We just moved everything around, and within a few days we were working differently. I just would like to reassure the general public out there that we never stopped seeing patients. We never, even in our most lockdown months, personally in my practice, we still saw over 1,000 patients face to face. But of course, the amount of telephone calls and video calls went up very, very significantly. And but our doors are open, and as Sarah said, we've implemented a different triage system. There's a lot online going on now, and the face of general practice has been changed very significantly. But furthermore, this move to place has actually given us an opportunity to engage at place much better with our local authorities. And we don't only do that in statutory and formal meetings like our committee in common, where we now have our local authority colleagues with us, but we also do that did that in our COVID response, where we had a regular members meeting with our local authority colleagues who told us how many care packages they were delivering, how many patients they had on their list, how many and what kind of vulnerable people we were looking after. So we had very, very good integration of services with the local authority, and that was the start. COVID was really the start, and the future is certainly very bright in terms of working together also on self-care projects, because when we talk about vulnerable patients and hard to reach group, it's not only important that now where we are in a business as usual situation with COVID, that we work up, you know, our diabetes reviews and make sure that our respiratory patients get the right care, and that we actually know how to diagnose COPD properly in a COVID world. It's also very important that we educate the general public. And I don't know how many of you have gone out shopping recently, but whilst in the big supermarkets, you find there's most people wearing face masks. In smaller shops, in the fish and chip shop, in some of the pubs, and so the attitude to safety can be a little bit less robust. And I think there's a lot of education that has to be done and can still be done to make sure that vulnerable groups don't get over proportionally exposed to this virus, and that their health conditions are taken seriously, and that we actually make sure that self-care improves in all areas. We've got certainly also good working relationships with Frimley Health Foundation trusts from place now, and those getting implemented and improved. We were one of the CCGs that switched on services very early. Some people still starting to switch on services. I would like to commend Lalitha for her leadership in actually switching on things very early. Already in May, we started discussing what we need to bring back and when we need to bring it back. And for example, contraception that was mentioned before by Dr. Sachdev in the slides was very early and very important to us to bring back. Or joint injections. We worked with our consultants on a way how we could bring back joint injections for our patients early in the face of COVID. And we also we are looking at GI community diagnostics with the support of Lalitha, and developed, for example, a pathway how we could diagnose in COVID times, a silver standard how we could diagnose COPD in the absence of spirometry still safely with our patients using other clinical markers. The other thing, on the final thing I want to also say is that our training for our health professionals has never stopped. So again, with the good support of our system, we've been able to continue training our GPs, our nurses, our health professionals in a variety of subjects. And we've tried to do that again online, and for example, a memorable session was one with Mark Laniado on urology, or very recently in September on COVID, and a respiratory session with the chest clinic in Windsor and with the adult respiratory community service we have, and Joanne King and some consultants. So overall, it's been an exciting time, not only for Bracknell, but also in terms of our integration efforts. And we want to continue those relationships and those services. Thank you.
Thank you, Martin. Good afternoon. I'm Hugh Thomas, clinical lead for RBWM and a GP in Maidenhead. At the start of the COVID-19 pandemic, across RBWM, we saw a great surge of community empowerment where people came together to support each other and those most vulnerable in our community. Winter's likely to be a very challenging this year, so we want to really harness that power of the communities to develop a different way of working together. We call this the RBWM Community Deal, and it's about building a different relationship with our local communities and residents. It recognises that public organisations no longer have the resources to do everything, And as individuals, we all have to take more responsibility to look after ourselves and each other so we can live healthy, happy, and in thriving communities. We've started to pilot this work in the Dedworth and Clewer area of Windsor, where we've already engaged around 1,500 residents through locally established education and housing services. We'll use the learning from this to support us as part of our wider RBWM Winter Community Deal. Our local authority and CCG colleagues are working closely to bring community groups together so that we can have one joined up conversation within each of our 3 towns. We'd like to have a conversation about what we're doing to help our population this winter and what people can do to help themselves keep safe and well. We'll also talk to our communities about the barriers people face when accessing health and care. As well as working to support our wider communities this winter, our vulnerable populations will continue to be supported by the multi-agency approach, which focuses on those with the most significant risk of poor outcomes from both flu and COVID-19. Practices within RBWM support more than 40 care homes locally. Services work really well together to support the care homes and their residents during our first wave of COVID and learned a lot from that experience. And over the summer, we've reorganised the medical services provided in many of the homes that they're supported in the most cases by single GP practices. This approach is bringing many community professionals to work closely together, centred around the individual needs of those residents. Alongside winter planning, our GP practices have been working hard to ensure that the flu immunisations have been targeted to those most at need in the highest risk groups. As well as delivering in-house sessions as we have done traditionally, both Maidenhead and Windsor primary care networks have opened really popular drive-through clinics, which has enabled people to receive their vaccinations in a safe and convenient way. Our focus in the coming months will be on maintaining services and support for all our population, and particularly to our most vulnerable groups who we know are at elevated risk from COVID-19. These groups include people with learning disabilities and severe mental illnesses, our homeless population, our growing BAME communities, and people who are extremely clinically vulnerable, as well as our older and frail population. In Maidenhead, our practices were one of the first areas in the country to use pulse oximetry monitoring to look after people at risk of poor outcomes from COVID-19 in the community. And we're developing our plans to roll this out across RBWM in the coming weeks. These are just a few of the examples of how we'll continue to support our population this winter as we move into the next phase of COVID-19. Our commitment across RBWM is to continue to work collaboratively with our partner organisations to ensure that we do the best for our local population. My time is up now, so I'd like to hand over to Jim in Slough for the Slough update.
Thank you very much, Hugh. Can you hear me?
Yes, Jim.
Yes, Jim.
Lovely. Thank you. I'm Dr. Jim O'Donnell. I'm the lead for Slough within the CCG, and I'm a GP at Farnham Road Surgery in Slough. I just want to talk about 3 things that we are focusing on in the future. Gone is the day when CCGs or clinicians like me or people working in any part of the NHS could reasonably hope to address the health and care needs of our residents solely by working in the NHS alone. In the future, and by that I mean now and in the time ahead, we will be working in partnership with those who serve the residents of our area, in my case Slough, especially housing, the voluntary sector organisations and local communities to help us address the deficits in what we call the wider determinants of health. And these wider determinants of health are the non-medical areas of life that determine the health outcomes of us all. Things like barriers to housing, income depletion, education, crime, social lifestyle habits, diet, exercise, smoking, and so on. And these non-medical determinants actually influence 80% of our health outcomes. And what the NHS provides itself, which is essentially quality care and access to services, determines only 20% of these health outcomes. or what happens to us from health-wise. So working together with the local authority, the Borough Council in Slough, to tackle fuel poverty, for example, poor housing, we will work with our colleagues to improve the quality of accommodation in Slough, because we know how damp and unhealthy environments have such a detrimental effect on people's respiratory health. The second thing I want to talk about is health inequalities. We remain ever more committed to addressing and reducing the inequality in health outcomes in our population. We want to improve the length of people's healthy lifespan and the health of Slough residents in all age groups. And we'll further improve on our success at preventing, for example, strokes and heart attacks, preventing people developing diabetes, or reversing diabetes if you're unfortunate enough to develop it. And we need to greatly improve our success and skill in diagnosing cancer earlier on. So those with cancer will have much better outcomes. The third thing is strengthening the capacity of general practice and primary care to deliver integrated care to their registered population, working with other practices in groups, other providers of services and care, to improve the effectiveness of these services, the access to these services that people need, and helping those who are in a position to help themselves. Working across the system, especially with hospitals, community services, mental health, social services, to deliver a more seamless, caring, skilled and friendly set of services delivered with kindness and understanding. So that's what I would like to leave you with in terms of our hopes for the immediate future. Thank you. I'll give over now to Dr. Lalitha R, who will field some questions, because I know we haven't heard enough from her yet. Thank you.
Thank you, Jim. Thank you to all our clinical leads for giving a perspective from their 3 places which form East Berkshire. So I have the job of taking us through the questions for the next 15 to 20 minutes. You will notice that the chat box that Andy Brooks alluded to at the beginning of the meeting is unfortunately not working. Our technical team has tried and have failed. So what I'm going to ask you to do is to raise your hands if you have a question. Please stay on mute until your name is called out. And if you keep your questions brief, then we can answer as many as we can today, and any unanswered questions, we will be replying to them and posting them on the CCG website. I have 2 questions that came to us before today, and I'd like to start with that, which means that it gives you time to think about your questions and raise your hands. So the first question that was sent to us was about choice, patient choice. So in a sense, the question asks, is there still patient choice in terms of choosing which hospital we would like to be treated at? This person says, my GP practice has said that their contract is only with Wexham Park Hospital and I am not happy being treated there. Could you please advise as to what is going on? Sarah Bellis has kindly agreed to take this question for us. Sarah?
Thank you, Lalitha. Choice is still available to people, and we would encourage that person to get in contact with our Powers and Complaints Department, and we'll work with them to come up with a solution, and we'll talk to our doctors in general practice about the choice agenda.
Thank you, Sarah. The next question was about GP appointments. So the question reads, I have problems getting a GP appointment and my diabetes is not managed well. I also did not get an appointment for my yearly review. They have done some blood tests, but I am not happy with my diabetes management. How are they helping patients who have diabetes? And I suspect this means how our practice is helping people who have diabetes. Caroline Farrar, who is our lead for primary care, is going to reply to this question. Caroline?
Yes, thanks, Lalitha. And we know that some people have found it difficult to access their GP, and that access does vary. We're working hard to support our practices with different ways for people to contact them and get their needs met, along with understanding where there are problems and addressing them. Long-term conditions reviews, including diabetes, are one of the things that practices have been asked to prioritise, and particularly to prioritise for those at increased risk. I think that obviously to provide most help in this situation, I think if the person who asked the question wanted to give us details via our PALS service, then we'd be able to investigate further on their behalf.
Thank you, Caroline. I can see in the audience we have Hassan Ahmed, who has raised their hand. Hassan, would you like to unmute and ask your question, please?
Hi there. Just a quick question. Can you update us on the closing of walk-in centres across East Berkshire, please? Is this permanent? Thank you.
Thank you, Hassan. Thank you for keeping the question so brief as well. I will ask Andy Brooks if he would like to take this question, please.
Thank you, Lalitha. It may also be helpful to bring in Fiona at some point to help clarify something. So as people recognise, we've talked about when COVID arrived, it meant that we had to very rapidly change the way we delivered services. In particular, we wanted to make sure that there was something called total triage. So people for phoning in advance so that we could try and minimise the risk of people meeting, whether they had COVID or not, and also try and therefore keep people safe. That included things like in general practice, people not walking in, but phoning up, and then we could triage people either to be seen in that practice or to be seen in hot practices, and to help keep demand away from the hospital. In East Berkshire, there were 3 walk-in centre or services, all operating slightly different ways. Again, so we took a decision to temporarily close those to make sure that we could keep people safe. However, we recognised that there was some capacity there in terms of staff, and so we worked really hard to use that capacity to do different things. So some of the people there worked in the hospital to help out, some of the people there helped out in community settings, some people helped out with visiting for people to try and make sure we got the access. Also, during this period, we've seen how 111 has helped, both in terms of signposting, but also with delivering some care over the phone. So we're actively thinking about how we plan that for the future, depending on the needs of our population, recognising that we're still in a situation where COVID is prevalent, and actually it is increasing again, as people will have heard. We also wanted to make sure that we kept people safe. Some of the facilities had people who were having cancer treatments, so making sure that we kept them as safe as possible was important, and using some of the facilities for the catch-up in chronic disease. I know one of people's questions was about diabetic management, so I know in Maidenhead there've been a lot of work going on to help people catch up with chronic disease, which was based in some of the facilities that walk-in centres were used. So I don't know, Fiona, was there anything you wanted to add from your perspective?
Not specifically, other than I suppose, but we would obviously encourage any of our population who need assistance with any health matters to either use 111 online and the telephone number, or contact their GP practice if they've got any particular urgent issues. And clearly, if it's an medical emergency, we do obviously, our local emergency departments are open, and are obviously for any life-threatening emergencies, do please call 999.
Thank you. Hassan, does that answer your question? I'd also like to just remind people that if you are looking for the icon to raise your hand, if you click on the icon at the bottom ribbon which says participants, underneath the names of the participants, there is a little hand icon. If you click on it, that's how you raise your hand. I can't see any other questions here. Let's give you all a moment to see if technology wasn't helping you, and that's why there are no hands. In our panel of speakers, is there anything that any of you want to allude to? In addition to what you've already said? Penny, Thank you. Penny, would you like to come in with your question? And feel free to unmute, but also show us your face if that's what you'd like to do.
Hi, thank you very much for the meeting today. It's really helpful. I just wanted to know, in these really difficult times, how can PPGs best support their practices?
Thank you, Penny. I will ask Sarah if she wants to come in here on this question.
Sorry, Lalitha, could you repeat the question? I was having problems with my sound.
Penny, would you like to repeat your question?
Yeah, I was asking how PPGs can best support their practices during these really difficult times.
Oh, I can sort of answer it, but maybe some of the doctors might want to, the GPs might want to come in on this. I think that by keeping in touch in virtual means of communication and to support those messages that primary care is open and that there are different ways that primary care is able to have its services, but making sure that message that primary care is opening, and if you need help and support, you should be seeking that help and support.
Thank you, Sarah. Jim, would you like to add something from a practice perspective?
Yes, indeed. Thank you very much. And what an excellent question, Penny, because it is absolutely crucial at the moment that PPGs have even the loudest voice they've ever had. And the reason for that is that practices, and particularly networks, groups of practices, need to hear from patients and patient representatives what it's like, how the service feels in this era where we have remote consulting and where everybody is triaged on telephone before they're dealt with or before they're seen. So I think to feed back to the practice and to inquire and to set up meetings, remote meetings with patients, with the practice population, to find out what the concerns of other patients served by the practice are. And particularly, I think we're keen to hear from patients who we don't hear from, who never darken our door or haven't done since March or February, for example, who haven't had telephone conversations or consultations with us. They're the patients we really worry about. And so to widen the feedback to the partners in a practice, to the staff in the practice from patients, I think is the biggest contribution that PPGs could give the practice now. It's never been more important. So thank you for your question, and thank you for your efforts, and thank your colleagues for their efforts too. Feedback from PPGs is so important.
Thank you.
Penny, our comms team always reiterate that PPGs are so vital to sharing key into the community, and they would like to extend the thank you as well. Our primary care lead, Caroline, would like to add to the answer as well. Caroline?
I think it's just, I mean, I'm relatively new into the patch, just over 6 months locally, and so I don't think we've met, Penny, but I certainly know of a couple of practices where PPGs were really active in supporting around the shielded population in the first wave, and really supporting that wider community group effort, that very local effort, and that might be a role that some PPGs would like to play or get involved in if we were to face such a situation again. Obviously, we all hope that we won't, but it may be harder to mobilise that next time. So that might also be something worth considering for people.
Thank you, Caroline. Martin?
Can you hear me?
Yeah.
You can't see me? Good. It says the host has stopped my video, so I can't, you can't see me, but that's all right. If the host can unlock my video, then I'm very happy to, you can see me as well. I think it's an excellent question, because whilst I was sitting here and you have asked this question, I was thinking what we did before COVID. And particularly in Bracknell, what we did was a lot of self-care stuff. So we had these kind of self-care events where we had, I remember one on arthritis, low back pain, diabetes, all sorts. And my PPG actually very actively in my practice set that up with us. And we did it with other practices. I know Ringmead practices did quite a few events and so. Now, what an opportunity it would present to do things like that on Zoom or online like we do now, and actually have some of these self-care meetings, group consultations on chronic disease management in that kind of format. That would certainly be an idea. And I think whilst in the initial phase of COVID, everybody thought about how can we reorganize our services. Now, rather than never, is the best time to actually start and develop future models of PPG involvement, particularly in self-care.
Thank you. I am looking for more questions, but I can't see any. So first of all, I'd like to apologize as part of the closing to apologize for the technical issues we've had, that you were unable to write your questions in chat. And more importantly, we were really keen on sharing the video that didn't play because it would have given you an opportunity to hear our young people. We will try and ensure that this is shared with all of you. There's also an evaluation poll at the end. So it'd be really good to hear from all of you. What I'm going to do now is hand over to Andy Brooks. He started the meeting and I'd like to welcome him to say a few words to close this meeting as I see no further questions. Andy?
Thank you, Lalitha, and thank you to all our presenters for sharing with us all what's happened over the last year, particularly in COVID. But most importantly, thank you to members of the public and our communities for attending. I hope you found it valuable. Thank you for your questions. Again, really sorry that we couldn't get the chat function working and the video, those will be posted. But please do send us your thoughts, comments, questions. It is really important that we hear from you. We do use those to shape things for the future. I'd like to wish you all well and thank you for your continued support. And again, just please, if you could fill in that evaluation form, that would be really helpful to us all. So thank you all. Take care. Please look after yourselves and stay safe.